All right, hello everyone. Thank you for joining today for our psych session. We're going to start off with going through and introducing, like, say who you are. What's your favorite thing to eat for the 4th of July? Let's do that. Got to spice it up a little. So, Kelli, if you'd like to go first.
Sure. Hi, I'm Kelly. I'm clinical social work faculty at WVU Behavioral Medicine and Psychiatry. And actually, I think my favorite thing to eat on the 4th of July, veggie hot dogs, grilled, because I never get a chance to grill them. So grilled veggie hot dogs with sauerkraut and ketchup.
All right. How about Lauren's Swagger?
Everybody, I'm Lauren Swagger. What am I? I'm a child adolescent and adult psychiatrist, and I really like corn on the cob.
Good choice. All right, Allison.
Hi, I'm Allison Flanagan. I'm with Mount West CTC. I would probably say the watermelon when it's so hot, like getting that lighter fare.
Did you know that watermelon is a fruit that you can have, like, if you're dehydrated in a pinch, and it will help rehydrate your body and give it the vitamins and minerals that it needs?
That is very cool.
All right, Anastasia.
Sorry, I had unmuting. Hi, I'm Anastasia Riley. I'm with the Positive Behavior Support Program at the Center for Excellence in Disabilities. And I'd like to say crab legs, but I probably will not have those on 4th of July. So I'm going to go with hamburgers.
There you go. Cassandra. Oh, you are muted, dear.
Sorry. I'm Cassandra with the Positive Behavior Support Program out of the CD. I would have to say a potato of any kind would be my 4th of July food.
Good choice. All right, Teresa.
My name is Teresa Bailey. I am also with the PBS program out at the Center for Excellence in Disabilities. And you people already took mine. My top two.
You can say it again.
Watermelon and corn on the cob.
Yes, you can say something that someone else has even said. It's okay. It's fair. All right, Jocelyn.
Hi, everyone. My name is Jocelyn Blackwell, and I work with Ritchie Regional Health Center, soon to be known as Integrated Health Centers of West Virginia. And I am the behavioral health case manager specific for SUD patients. And my favorite 4th of July food is macaroni salad.
My uncle makes the best macaroni salad. All right. And who hasn't went yet? Sorry, the Hollywood squares keep moving around on me. Ashley Benson.
Hi, I'm Ashley Benson with WV's PBS program as well. And I would have to say that my favorite is pasta salad of any kind.
All right, so now I am extremely hungry. Did I forget anyone? No? Okay. So I am Kelly Guthrie. I am the West Virginia CTSI program coordinator for Project Echo, and it's nice to see everyone. I really wish I could say I had a favorite food to eat for the 4th of July, but I have no discrimination except for olives, and I'll eat anything. Olives are a no. So we are going to go ahead and get started today, and we have Miss Kelli Kuzniar that's going to be presenting, and I hope everyone enjoys.
No, I will take your olives because I love olives of all kinds. So
you can have them.
Okay. All right. Let me share my screen. Whoops. Nope, I did the wrong thing. Share screen. Okay. That's it. It is. Alrighty. Let's go to slideshow. From the beginning. Can everybody see it? Okay. Yeah. Okay, great. All right. So obviously it's a small group today, so please chime in with any thoughts, questions, anything, comments on the presentation today. It's not the most cheerful presentation right before July 4th, but obviously I think a very and everyone will think a very important one when talking about child abuse and neglect. Okay, so the presentation is on the impact of child abuse and neglect. Right, and this is a short video, but I think it does a good job of, if I can get it to play, there we go, of explaining just generally kind of child abuse and neglect. So I'm hoping it plays. Can you hear it?
We can all work together to make sure
Yeah, you can
every
hear it.
childhood is free from abuse. Right now, on average, 2 children in every classroom are affected by abuse or neglect. Child abuse can take many forms: emotional, physical, or sexual. It can also be neglect, which is a lack of love and attention. Whatever form it takes, the damage can be devastating, but together we can prevent this from happening. What surrounds us shapes our behavior. When parents are overloaded with problems such as money, alcohol or drug addiction, or mental illness, it can be really difficult for them to give their children the best start in life. Those stresses can lead to a child being abused or neglected, and this is never acceptable. But providing the right help at the right time can help a family cope, giving children a more stable platform. Child abuse can derail a child's development, affecting all parts of their life. It stops them doing what children should be doing, like making friends, learning, exploring, and playing. As the child becomes an adult, they may struggle with important things like relationships, jobs, or mental health. And this causes a ripple effect through the whole of society. But we also know that when the community comes together, we can help get children back on the right track. Whether it's help from neighbours, extra support at school, good foster care, or counselling, we can all play a part. Abuse robs children of their childhood. Instead of feeling excited about the future, it can make them feel worthless, ashamed, frightened, and alone. But it's never too late to make a difference and turn a life around. And that's why we need to come together to create a stable foundation for all children. You can make a difference. Each individual act may seem small, but if we all play our part, we can create a safer place for all our children. That's why we're here. That's what drives all our work. Join us, because every childhood is worth fighting for.
So in the United States, this statistic is 1 out of 7 children experience abuse, but in my recent research, it's more like closer to 1 out of 4. So if you think of a classroom, right, you typically have 20, 22 students. So at least 5 of those kiddos have experienced abuse in some way. Okay, so as the video noted, sorry. About that. There are 4 types of child abuse and neglect. We have physical abuse, which is, that is not the accidental harming of a child. It is the intentional harming of a child with corporal punishment that is done in a very angry state, because most states do allow, not that I agree with it, but most states do allow like an open hand on the bottom, right? A form of corporal punishment. But when we see physical abuse, we typically see parents who use items like spoons, cords, other things in the household to hit their child. Have had children who have been like whipped with whips from their parent. So that's physical abuse. Sexual abuse is any act of sexual nature, okay, upon which a child, for the sexual gratification of the perpetrator or a third party, including anyone who allowed it or encouraged it, right? So this is maybe the sibling of the perpetrator, could be the partner of the perpetrator. If they know that this is going on and they don't do anything about it, they're as guilty as the perpetrator. Okay. Emotional abuse. This is kind of the most difficult one to prove when you're calling CPS. And unfortunately, because we do see it so much, right? But it's one of the ones more difficult to prove. And this is chronic attitudes or acts that interfere with the psychological and social development of a child. Okay, so when a parent harms a child's mental and social development or causes emotional harm, this can be done through name calling, right? Degrading the child, embarrassing the child with the intent of degrading them in front of others, making fun of the child. So emotional abuse can happen in so many ways, but again, one of the ones more difficult to prove. Neglect. Child rearing practices, which are essentially inadequate or dangerous. The failure to act on behalf of the child, not providing the care, supervision, affection, and support needed for a child's well-being. We see this a lot with not having, like the supervision, particularly we see a lot of not having appropriate surroundings or housing, not necessarily due to poverty, because you do have to be very careful with that. If a parent is trying to provide as much as they can with what they have, hopefully the CPS response would be to then help that parent gain more resources. But if a parent is just willfully saying, like, I don't care, and I don't care if they don't have enough to eat or they don't have clothes or they're not providing for them. So that's neglect. And we will talk about neglect a little bit later on when we're talking about kind of the mental health implications. So the impact of abuse and neglect on brain development, okay? So on the left-hand side, you see typical development, right? Survival is a little part of the triangle, the very bottom, like not too much worrying about that because you should have, caregivers who are watching out for you, who are providing for you. So your survival shouldn't be your primary response. Regulation, social, emotional, cognition, that's typical development. Unfortunately, with developmental trauma, that triangle is flipped, right? This kiddo has to worry about, either having enough food to eat, having a place to sleep, not being a victim of abuse, either physical or sexual. So their main focus in their young life is not like, okay, I'm going to go to school and I'm going to learn things. I'm going to play with my friends and, I'm going to go to, birthday parties. That's not what they're focused on. They're focused on essentially staying alive and not being harmed by folks around them, folks who are parents and caregivers who are supposed to take care of them. And I don't want to sound, because that sounded a little bit judgmental, and I don't want to sound judgmental about parents who are unable to provide, the care that their child needs, or that they are themselves they're abusive to their children, because we do have so much intergenerational trauma where the parents have experienced so much trauma in their lives and their family history that sometimes it's very difficult to recover from that without help. And their response to their child is what they learned from their family of origin, along the way. So I don't want to sound judgmental about the parents, but from my work and what I do, my focus is on the child and keeping them safe and helping them to recover from trauma experiences. So responses to trauma, and everyone's probably heard this, very familiar. I'm not sharing, I think, anything new with anybody. So, initially we thought it was the kind of the fight and fight or flight, right? You either fight when you have a perceived threat, or you get ready to run, right? You run away from it. And now we have learned that there's also the freeze response, basically like you're not able to do anything, like you are just frozen in your feet, you just can't move, you can't do anything. The fawn, which is the pleaser, right? The person who pleases to avoid conflict. I have a friend who adopted two little guys, and one was the fighter and one was the fawn. And so two very different responses to similar experiences, and having to address them differently. Okay. And then the flop, which is to collapse essentially and to faint, become unresponsive. So they're just not able to, like, their body just is overwhelmed and they just are completely unresponsive or faint. Okay. This is, and if anyone has seen this already, I apologize, but this is Dr. Burke Harrison. Wait, so that's right. And Harris, I'm sorry. And she was one of the first ones to really, she's a physician, and she was one of the first ones to really incorporate adverse childhood experiences and what those are and how they impact a person, not only when they're young, but how that longitudinally really impacts an individual's health, physical health, mental health, possible substance use, education, and so much. This is a shorter video. So I'm going to go ahead and play that because she can explain it so much better than me.
The term ACEs stands for Adverse Childhood Experiences.
Oh, I'm sorry. Oh, I didn't realize I would do that. I apologize. I was going to answer the chat. What did I do now? Does anybody know how to get this back? There we go. Sorry about that.
The term ACEs stands for Adverse Childhood Experiences. And these are stressful or traumatic experiences that happen in childhood that can increase the risk for significant health, mental health, and behavioral consequences later in life. They really come from a big landmark research study that was done by the CDC and Kaiser now more than 20 years ago, in which they asked adults about their history of 10 categories of adverse childhood experiences. And these include physical, emotional, or sexual abuse, physical or emotional neglect, or growing up in a household where a parent experienced mental illness, substance dependence, incarceration, where there was parental separation or divorce, or intimate partner violence. What they found was, number one, ACEs are super common. And number two, that there's this really significant effect. So there's a direct, what we call a dose-response relationship between adverse childhood experiences and some of the most significant and serious health conditions that are facing Americans today. 2/3 of individuals had experienced at least one, and 1 in 8 folks had experienced 4 or more. When we talk about how many of us have experienced ACEs, what we see is that ACEs impact every community, every demographic group, but it impacts our vulnerable communities in a disproportionate level. The big surprise about the ACE study was that for someone with 4 more ACEs, their risk of heart disease was double, right? For stroke and cancer and liver disease and diabetes, even autoimmune disease. And a lot of these things are things that we didn't kind of traditionally or intuitively associate with childhood trauma. But now we can use this science to understand actually what happens in our brains and bodies when we're exposed to trauma or adversity, and especially in childhood. The term, the toxic stress response, actually refers to the prolonged activation of our body's stress response, the release of all those stress hormones like adrenaline and cortisol and all those things that go along with our stress response. And then also the ways in which that affects our bodies. Children are especially vulnerable to this repeated activation of the stress response because their brains and bodies are just developing. So high doses of adversity in children actually changes the way their brains develop. It changes the way their hormonal systems develop, their immune system develops, and even the way their DNA is read and transcribed. And those long-term changes are what we refer to as the toxic stress response. One of the things that's really challenging about ACEs is that they tend to repeat in families, generation after generation. And I will say this as someone who has experienced my fair share of ACEs. Understanding how that might be impacting me and being able to recognize that, for me, is really the key for being able to do things differently. When we understand what happens in our bodies with the toxic stress response, and we understand that it's that prolonged activation of our stress response, then step one is really understanding what are the things that help to regulate our stress response. And immediately at that point, we begin decreasing the harm that happened as a result of our past experiences. So things like mindfulness, right? Meditation, spending time in nature, mental health interventions, regular exercise, nutritional strategies, and my favorite, healthy relationships. All of these things are really scientifically demonstrated to help to regulate the biological stress response, and they improve our outcomes for those of us who have experienced ACEs. These nurturing relationships, they feel good, which is good, of course, but they literally change our biology. When we have safe, stable, and nurturing relationships in our lives, it improves our neurologic functioning, it improves our hormonal regulation, it improves our immune functioning, and these social supports are a critical part of healing. If we all understand our role in being a source of buffering care to a young person in need, that is truly transformative. ACEs Aware is a first in the nation effort to train our healthcare providers how to screen for adverse childhood experiences and how to respond in an evidence-based, trauma-informed way that helps to improve outcomes for children and adults. ACEs are not destiny. Even if someone has experienced significant ACEs, it doesn't mean that they are absolutely going to have these negative outcomes. Recognizing our ACEs requires us to recognize our vulnerability. And that can be really scary. But it also is the place where we get a chance to ask for what we need. I deeply believe that we can cut ACEs and toxic stress by half in one generation.
Okay. So a lot of information in that short video. If anybody has questions or comments, definitely would like to hear that. As you know, as we look at adverse childhood experiences, I think when the study first came out, it was such, well, so impactful in so many ways, but I think the focus was so much on, okay, the ACEs, right? The adverse childhood experiences and how negative it was. But then as work continued, folks were looking more at, okay, well, what can turn this around? Just like Dr. Burke-Harris was talking about, what can turn this around, right? The what can help a child heal from this? So with adverse childhood experiences, and again, I know this is not the first time y'all have heard of this, so just reviewing it, but looking at in a kiddo's lifetime in their childhood, if there's substance abuse, domestic violence, maternal depression, emotional and sexual abuse, divorce, mental illness, a parent has a mental illness that's incapacitating, incarceration of a parent, homelessness, physical and emotional neglect, right? Then we also have the community environments, which is an important point to look at as well. You're looking at poverty. You're looking at community disruption. If the kiddo lives in a violent area where there's a lot of crime and they're constantly having to be hyper aware of what's going on around them because of the violence, discrimination, okay, based on race, gender. So that's another huge factor in this as well. Poor housing quality and affordability. We know this is such a huge issue in everywhere, not just here. And when I lived in Florida, it was a huge issue down there because housing was so expensive. And then lack of opportunity, right? Economic mobility and social capital. Because if you've experienced all of these things, you've had so many adverse childhood experiences, it does impact your ability to, focus in school and to look at the future, right? Like, what do I want to do? What, is college, is a technical training, whatever. It really can block that. So then that impacts, right? Not only the emotional health, but also the possibility of opportunity and economic stability. So as Dr. Burke-Harris was talking about, we have kind of this lifelong impact of ACEs. So as you see, we have the generational historical trauma that I talked about earlier that we see in so many families, almost all families. I'm going to confidently say that, right? I think every family has some history of at least one or two of the ACEs, right? Race, social conditions, local context, complex trauma, ACE. So disrupted neurological development due to the toxic stress that Dr. Burke-Harris was talking about, coping, adoption of health risk behavior, burden of distress, disease, criminalization, and stigmatization and early death. And as she was talking about, like things like, heart conditions, diabetes, the study was first noted because a doctor was working with folks who were obese. And one of the questions, I think it was actually a mistake on the question form. And it asked, like, if you've ever had a history of rape. And then that started this whole process. But we can look at what this early trauma, because there's so much stress on the body, what it does with brain development and, creating chronic disease, and how it just impacts the overall development of the physical body and the emotional health of the individual. Okay. But the positive thing, and I think that, like I said, initially when all this came out, it was just always so negative, like, oh my gosh, ACEs, and what are we going to do? There's no recovering from this, right? But there is recovery from it, and again, as Dr. Burke-Harris said, but we look at protective factors, right? And it can be a child who's just very emotionally competent, right? We think of that as kind of that resilient kiddo that no matter what happens, they get back up, right? Having support in times of need. And this can come from not necessarily, the caregiver or somebody in the home. This can come from the school, right? The aftercare, any like church group, if the child's in a church group, that one person who pays attention to that kiddo and gives them that emotional support that they need can make a huge difference in the life of that child, regardless of the number of ACEs. If they have that one person that they can turn to, that they can talk to, that they feel that they get support from, and that this person is really listening, it can turn things around for that child. Supportive social connections, obviously, having more support is better. And looking at, schools and church and whatever other community organizations, like aftercare or even summer camp, those sorts of things really provide support. So that's why I know with kiddos that I work with, I always, see like what they have going on in the summer. So they're not just at home all day and they don't have connection to anybody, because that's really important. And the knowledge of parenting and child development. I think if we can help folks understand how important it is to provide not only, shelter, clothing, and food, but that love and unconditional support for their child, that's, definitely a protective factor. Okay. Everything has been kind of like, it's kind of heartbreaking so far. This is really just a cute short video on the concept of resilience. And I use this video with kids, and we actually create, not as nice as you'll see in this video, we use kind of like the plastic Easter eggs, but we create these dolls to show that, well, I'll show you the video first and then I'll explain it.
Who does it look like? It looks like me. That's right. I want you to do everything that you can to knock your toy down. Who is the strongest in class? Come on up, please. I'm going to give Jaron a prop, and he's going to try to knock it off the table. Ready, Jaron? Okay, children, who can tell me what it means to have resilience? Yes, Paige. Resilience means if you make the toy fall down, it can get up very, very fast. Very nice.
Okay, so that was such a cute video and it always makes me smile, so that's why I like to include it, especially with such a heavy topic. But as you see, like the little dolls, they got knocked down, but they got back up. So with kiddos, I show this video and I use like the plastic Easter egg, right? And we talk about what we need to help ourselves get back up. And we use clay, like little pieces of clay, to weigh the bottom of the egg down, because we need that. So each piece of clay represents something else. And then they decorate it. So they have their own doll or own egg that looks like themselves. It looks like themselves. And they're able to see that, yes, okay, you can knock it over, but it gets back up. And why does it get back up? And like we were talking about, the all those protective factors. And typically one of the most important things is having that one person. I can't emphasize that enough with kids that I've worked with. I've just seen that having one person that they can rely on makes a huge difference. So, looking at childhood trauma, which includes obviously abuse, neglect, sexual abuse, we look at how it does impact the kids in their brain development. You can see a smaller brain size, less efficient processing, and impaired stress response. In their cognition, impaired readiness to learn, difficulty problem solving, and language delays. This was something for me that when I learned about this, how language can be impaired, just because if a child's experiencing so much abuse or neglect, they don't talk and they don't interact with folks in verbalizing what they need or what they want. So that language can be delayed for that reason alone, right? Just the fear of talking. So physical health, sleep disorders, eating disorders, the immune system. We all know from everything that's, out there now, that how stress impacts our immune system. So kiddos who experience a lot of this are often sick a lot, right? And a shorter lifespan can even happen because of all of the stress, the intense stress response. Okay, emotions, obviously difficulty controlling emotions, trouble recognizing emotions, limited coping skills, shame and guilt, because a lot of times, and it's surprising, kids blame themselves when they're abused. We see this a lot with kiddos who have experienced sexual abuse in particular, that there's a lot of shame and guilt and they blame themselves for it. So the emotional aspect of it, you can, more readily see with kiddos who have experienced abuse or neglect. So relationships, attachment problems, right? So with the attachment problems, if you have a kiddo that's, their needs are not being met, particularly from 0 to 3, then they learn not to trust the environment around them, right? Like, I'm crying, I'm hungry, or I have a wet diaper, I need someone to help me, and nobody does that. So they learn that the world is not a helpful place. The world is a harsh place. And they don't connect with an individual. And we can see that later on in something like reactive attachment disorder, as a possible diagnosis for kiddos who have experienced significant neglect. Mental health, we see kiddos who have experienced abuse and trauma, or abuse and neglect, with depression, anxiety, negative self-image, again, from feeling that shame and that guilt, blaming themselves. If I were a better kid, my parent wouldn't do this. This is my fault. So behavior, they have obviously poor self-regulation because they're responding all times to a stressor. So that that response from the amygdala is going to be, hyper present for them. And that's what they're going to be focusing on all the time. And it's very difficult for kiddos to transition out of that when they've experienced severe neglect and abuse. So social withdrawal, we see kids with aggression, poor impulse control, risk taking, particularly when they're entering adolescence, sexual acting out if they've experienced, sexual abuse, and drug and alcohol misuse. So we see so many results, and I can think of kiddos that I work with now that have something from each category that they're dealing with. Okay, so in my viewpoint, and this is from my clinical work and my experience throughout the years, that treatment starts with trauma-informed care. Okay, trauma-informed care is necessary to be present in organizations that kiddos engage with, right? That they need to have healthcare centers, behavioral health care, right? Schools that recognize that most kiddos have experienced trauma, 1 out of 4, right? So the 4 R's of trauma-informed care are: realize the impact of trauma and how widespread it is. Recognize the signs and symptoms of trauma. Respond by integrating knowledge about trauma into your policies and practices, right? And then resist re-traumatizing children and adults as well. Now, with responding by integrating trauma-informed practices into your policies and procedures, this has to obviously come from the top down in whatever organization that you work for. This is not an easy thing to do. This takes several years for an organization to truly become trauma-informed. And trauma-informed care even assumes with the staff working in the facility or working at the school, you know, that 1 out of 4 staff have experienced trauma, right? So they're taking that into consideration and how to even set up the space, right? Waiting rooms, that they're very friendly and warm, and you know, patients feel safe there. So something as simple as the waiting room, right? Just looking at all practices and how folks manage, you know, employees and manage sharing of information and supporting. So becoming a trauma-informed agency or facility takes many years, but it's definitely needed with the level of trauma that we see, and hopefully will increase as the years go on. Evidence-based interventions to use with kiddos who are presenting with exposure to abuse, neglect, or sexual abuse. Trauma-focused cognitive behavioral therapy, that is my go-to approach with most kiddos, because it does address all of those areas of learning how to understand what we're feeling, why we're feeling it, how to express it, how to develop assertive communication so we can ask for what we need and share what we need, and then, you know, positive coping skills as well as the next step, and then creating that narrative of the trauma so that we can gain control over it, right? And gain control of how it's making us feel. So TFCBT is my favorite with it. We have integrated play therapy, which for kiddos under 12, and depending on the kiddos, like intellectual level or emotional level, play therapy may be appropriate for some older kiddos. Trauma play is another type of play therapy that's, as the name, as you can assume from the name, involves addressing trauma and working a lot with post-traumatic play. So where kiddos are able to engage in client-centered play, where they are able to, in most cases, kind of reenact the trauma, but with a different ending. So they're able to control that ending of what happened. And through that, they're able to feel in control of it, because that's often what we see with kids who've suffered abuse and neglect and sexual abuse. The need for control is paramount for them, and because so many things were out of their control of what happened to them. And then attachment-based treatment, when we were talking about the kiddos who've experienced severe neglect, right? We have reactive attachment disorder, which in years past used to be like, oh my goodness, there's nothing we can do with this. But that is not true, because we have neuroplasticity, our brain can learn new things. So there are so many new treatments and new ideas available to address attachment. I work with several families, one who, an adoptive client who was adopted by the family, but other kiddos who, just through the stress of everything, of the abuse, the neglect, the domestic violence, they may have lost that connection with the parent. So we work on that to reconnect that attachment, because we know attachment to one person will help to pull that child out of this spiral of abuse and neglect. And then obviously psychiatric care, because sometimes with severe cases, we do need something that will help that kiddo regulate physically, right? As they're learning how to gain the skills they need to empower themselves to control and regulate their emotions, but they might need medication to help that process. Okay. And anybody who knows me knows that I will talk about trauma-informed schools. I put it everywhere that I possibly can, just because I think, you know, in the school setting, we have these kiddos all day long. we can really put services in the school to help the school become trauma informed, that's where it really needs to start, because you can do all the clinical work that you can with that individual child and it will help. But if that child's in an environment that's trauma informed, that's going to provide even more of that support. Okay, so with trauma informed schools, the school system understands trauma and stress. They have cultural humility and equity, safety and predictability, which is so very important for any kiddo who's experienced abuse or neglect, because they need to know what's going to happen. They need that structure to feel safe. Compassion and dependability, compassion from the teachers, administration, and dependability that, folks are going to be there for them. And there's going to be somebody, if they need to talk, that they can go to and talk to that person who will help them. Okay. Empowerment and collaboration, resilience and social emotional wellness, right? But as we see, it starts with the system and leadership, goes to the staff and caregivers, and then trickles down to the students. So that's my big plug. And that's what we're trying to work on here. So setting that up. Any questions? Oh, I almost took the whole time. Oh, okay. Any questions or comments or disagreements or anything?
Kelly, whenever I was teaching in public education, there was a lot of stuff you can tell from students. And I was with a high school setting. So you always had to find a way to connect to make the students feel comfortable. And my aunt is actually she's really good at teaching and connecting with her students.
Yeah.
And a lot of her students have a lot of home issues. So she always makes that connection to try to provide them a safe space and somewhere to go if they need.
Oh, that's wonderful. That's so wonderful to hear. We need that happening in every classroom, in every school, everywhere. So please thank your aunt for me, because I love that. Thank you.
As I say, I have so many things this is like a really great presentation. And like really well organized and helps, it's really, really great knowledge and information. I feel like a lot of us, have this like knowledge basis, and when I'm working with like positive behavior support. And so we're going into the homes, working a lot with the families. Like my goal has always been to work by building up the family's capacity, because a lot of times it's, they're doing their best, or what they've been taught, when they were growing up, this is what their parents said. And so then we kind of see this like cycle, and then the children are reacting because, it's they're experiencing trauma from that. And you see this like behavior cycle that starts again, where the parents are pushing out, the kids are pushing back and doing their best with it anyway. But my biggest one is, you talked about the schools like needing more education on trauma-informed care. And I can definitely see that. But the other side of it, though, is it is heartbreaking for me when I'm working with families and they're working with providers that are telling them like, oh, well, put the child in the corner and face the wall for like 10 minutes. And it's like, it's providers, it's people that have social, masters in social working degrees. It's people, and I'm just like, how is this like, continuing to be propagated so heavily? And like, how do we interrupt the cycle? How do we like truly, and that's the biggest one, is like, where do we go with this? How do we, really instill it and give it to the, like, the greater population? Because otherwise, we can always feel like otherwise we're handing the children gas masks while their family is still unintentionally lighting the house on fire. And it's still like, very cyclical in nature. And trying to get that out there has just been so, I always try to catch, if I ever hear provider, and I'll have that discussion. But other than that, though, what do we do?
Yeah, I completely, that was said so well about all of it, actually. And I do agree that, unfortunately, some providers are not trauma informed. And that's where, education, things like the ECHO, other types of methods to get the information out there, to let them know like how that really impacts the kid. If you have a kid who has suffered trauma and then you're putting them in the corner, that just escalates, right? Or if you yell and scream, that's going to trigger any trauma response that they have. And, so working with parents, working with providers, right? Also teachers. So something that we're trying to do is get in with like the School of Education, because unfortunately, teachers aren't provided this information, right? They're not taught this. You might have, the few that are very kind and just do this naturally, right? From their own maybe life experiences or their big heart. But teachers aren't equipped. They're not trained to deal with all of the behaviors that are demonstrated by students who have experienced abuse and neglect. And so you're looking at a fourth of a classroom, right, of kiddos who may be acting out. Now, some of those kids internalize behavior, so you don't necessarily see it as you would the externalizing kiddo, but teachers just aren't equipped to deal with that. So we have to take that piece on as well and really make sure that they know what to expect, because I think it really, is just something they're not expecting. It makes their job, even harder just because they don't know how to deal with the behaviors. And then we see within 5 years, teachers are leaving the field. So, and it's in part because of not being able to manage behaviors. So it's working with all of those institutions, right? Providers, educators, and just trying to get as much information out there as possible, about trauma-informed care. But thank you, Ashley, for your comment. I appreciate it. And there was, I don't want to pull up the chat because then it pulls it up. I think I share it. So, or it stops my screen. I don't know if there are any questions in the chat.
I just was echoing. I completely agree with what Ashley said. But I also think it's not just trauma informed. It's also just normal development, right? And sort of needing that child specific education, especially for young kids. And, I think that's another big part of it, right? Especially for kids under 12. Most of us as adults forget what a kid's capable of. And so I think one of the biggest challenges on top of that is also realizing, like, especially with trauma, focused CBT, right? I love it too, but it does have the B in there. And sometimes people get so focused on the cognitive piece, or that you have to talk about your trauma is one of, this is the last thing you do, right? Is just recognizing that, a lot of those skills from psychoeducation to behavioral interventions and physical regulation, regulation skills, right, are critical. And I think sometimes we forget to assess those things before moving on to some more advanced skills. And so I loved your presentation. Wonderful.
Thank you. Thank you.
As a recently retired K-12 educator, a lot of the information that you presented is given to teachers annually in their mandated reporting thing. But the problem is that it's given by people who don't have the kind of experience that you have. And it's usually the guidance counselor, the school guidance counselor that got the presentation 2 days ago. And has very little actual experience in or education in dealing with that. And so if there's a way to get the School of Education to include some of this stuff in a classroom, on classroom management, on SEL learning, and I have said for a very long time that our teacher preparation programs are inadequate for the task with which teachers are faced on a daily basis.
I agree.
And so, and as a person who works adjacently to the university, and if there's anything that I can do to help get this into a classroom for teacher preps, call me, email me. I am right there, because this is one of those things that is really so important.
Wonderful. Thank you so much. Yeah, we're looking at how to get in there, right? And then to infuse within the training all of this, because teachers are dealing with this. Everything we've seen, they're dealing 7.5 hours a day in their classroom and giving them more skills to manage it better for the kiddos, right? But also for themselves, so they're not so frustrated with everything.
Right.
Because I worked in a school for 7 years, so I saw both sides of it, and I saw how teachers really tried but they just didn't understand, right? And then I would have teachers say, oh, well, I have 7 aces, but I'm fine, so what difference does that make? And they weren't fine.
Yeah, right.
So I agree. So thank you, Teresa. I will be reaching out to you. Thank you.
Kelly, I have one question.
Sure.
In my experience, I've seen all kinds of different trauma responses from kids, parents, adults, everyone has a trauma response. Do you find in your work that, especially with a child, that maybe their primary way of responding to trauma would also be conducive to how their parents would respond to trauma, in terms of like that learned behavior in the response itself?
Okay. Yeah, that's a very good question. Yeah, obviously, kiddos do learn from the modeling of their parents and in lots of different behaviors. So if, say, the parent is a screamer or that's how they manage their emotions, then most likely that kiddo will replicate that. So yes, we do see that a lot. And it does depend obviously on the individual child. And like I said, some kids just have a more resiliency and are able to deal with it better. But I do think that whatever is modeled, just like when you're modeling, appropriate or healthy emotional regulation, if you're modeling inappropriate or dysfunctional emotional regulation, that kid is going to learn from the parent. So definitely. Yeah, definitely.
Thank you so much.
Thank you. Any other questions? I'm sorry. I'm sorry, Kelly.
No, you're fine. You're fine. Does anyone else have any more questions? I need to bring up my slide here so I can remember.
Oh, I'll stop sharing.
Again.
Sorry, I need to stop sharing.
Oh. Okay. No, you're fine. You're fine. All right. So our next session is going to be on August 7th, and that will be led by Dr. Lillard. All right.
Sounds good.
See you all then. Everyone take care. Have a good holiday.
Everyone. Happy 4th.
Happy 4th.
Happy 4th.
And Teresa, I'll be contacting you.
Okay, great.
Thanks.
Happy 4th.